Hey y'all, it's Dr. Lott with Bellevue Specialty Eye Care coming back for part 2 with Stephen Nedoroscik and what exactly is going on with his vision. So in part 1, we talked about the esotropia or the strabismus that he has. Part 2, we're going to be talking about the coloboma. What is a coloboma? It's a pretty cool word, but what does it mean? Coloboma is something that you are born with. Whenever you are in utero and the eye begins to take shape, sometimes it does not close all of the way. And you can have a coloboma in one or two or both places. The first one being in the iris. And so the colored part of the eye, it almost looks like there is a hole and there's two pupils. Actually, there kind of are. And so what happens is whenever our eye gets in bright conditions, the pupil constricts to protect our eyes so we're not so light sensitive. However, in patients with an iris coloboma, when their pupil constricts, there's still a second pupil, leaving them very, very sensitive to bright lights. The second type of coloboma you can have is actually in the retina, the tissue in the very back of the eye, so that whenever that eye closes, sometimes the retinal tissue doesn't come all the way together like it should. You would think that this would leave you with extremely poor eyesight. However, in many individuals, never affects their eyesight. In some, if the macula or the central retina is involved, they can have decreased eyesight, but in many, they live perfectly normal lives. So that is what colobomas are. Stay tuned for part 3 on how we manage strabismus and colobomas here at Bellevue Specialty Eye Care.